We have discussed about hair fall, hair loss, and when do you need a hair transplant, who's the right candidate for hair transplant, and what are the best techniques available for hair transplant. Now I'm going to be explaining in this video about how to choose the correct surgeon. My name is Dr. Desai. I am a board certified cosmetic and plastic surgeon. I am a super specialist. I practice in Santa Cruz West. I have over 20 years of experience in hair transplants. How do you choose the right surgeon for hair transplant is often a dilemma that every single patient faces. If he's been referred by another patient, it's easier for him. But if he's not referred, he doesn't know, then how does he know? Number one and first criteria is, I mention always that I'm a board certified cosmetic and plastic surgeon. I am licensed, I have a registration number, and I am registered with the Medical Council of India and NMC to perform cosmetic and plastic surgeries and hair transplant. And that is my qualification as a super specialist. Hence, I am M.Ch and D.N.B plastic and cosmetic surgeon. What is the meaning of that? This means a certification. Would you go and do a heart transplant or a kidney transplant with an unqualified person? Then why would you go to somebody who's unqualified or a technician or a nurse to do a hair transplant? Okay, hair transplants originally were done by plastic surgeons and were taught by plastic surgeons to others. So you must look at least at a plastic surgeon or minimum a surgeon or a dermatologist. There is no other field that can do or perform hair transplants. Nobody else is allowed to do it. They may do cheap hair transplants, they may do it in parlors, etc., but they are not qualified to do it. There's not one but several cases of mishaps which have occurred because of doing in such places and trying to save money. And hence be very careful when you go to a hair transplant surgeon. When you come to my clinic in Santa Cruz West, you'll see outside everything is displayed. My registration number, my MCI, my NMC number, my qualification and my certificates. And hence I am registered to do and I'm board certified to do hair transplants in this country. Many times doctors just do some weird courses, fellowships, XYZ things and then say that I do hair transplants. First I did 6.5 years of MBBS after 12th standard. After that I did 3 years of surgical training and then I did 3 years of plastic surgery and cosmetic surgery and hair transplant training and then I reach where I am. So this is the kind of qualification that is required in order to reach this place. Can you ever compare this with somebody who's just a dentist or an MBBS who's just done maybe a few years of training, not even in surgical skills, and then does 15 days or a 1 week or a 1 month fellowship to somebody who's done this for so many years? No. Hence, experience counts, qualification counts. So please search for a board certified cosmetic or plastic surgeon or at least a dermatologist to get your hair transplant and hair loss problems solved. Okay. Second, look at the experience. Okay, there are many people who do hair transplants occasionally. There are many plastic surgeon dermatologists who do everything and do hair transplants also. They do these kind of procedures maybe once a week or maybe twice in a month or once in a month. As compared to a center like ours, which does couple of hair transplants every single day, having a large dedicated team which is dedicated only to perform this surgery. Don't you think that a team like this would be far more equipped, specialized to handle hair transplant and hair loss problems rather than people who are doing it once in a while or occasionally? Okay, so hence the experience and the number of procedures performed, the dedication of the team. Third, make sure that the doctor whom you go to has enough experience, is well abreast with what happens globally. Personally, for me, I am on the scientific board of so many international committees. I organize 3 conferences in India. I'm the scientific chairperson. I am called for at least more than 2 or 3 conferences every single month. I at least travel twice, at least 2 to 6 times in a year to attend international conferences. I make it a point to read every alternate day about what is going around in the hair transplant market. That keeps me abreast. Like for example, this advanced technique of FUE called DHI was introduced. I am the pioneer. I started this technique and I introduced this technique in India. Number 2, exosomes. When I talked about exosomes in India 2 years back, nobody even heard of or knew about it. Because I travel so much, I'm abreast with what happens globally. I interact with all colleagues from all over the world, hence I'm abreast. So it's very important that the person whom you go to knows exactly what are the global trends, what are the newer things, newer molecules that I introduce. I've given over 150 presentations globally, and I've had publications, more than 10 publications. So hence I keep myself abreast with what happens in the world. Okay, so always choose the surgeon accordingly. What is his qualification? What is his experience? How well read is he? And how well does he keep himself abreast with what happens globally? Okay, all these factors are very, very important. Plus the dedication of the team. Now, many times when patients get a hair transplant done here, they say it went off so smoothly. If it goes off smoothly, not because the procedure is simple, it's because we have formed SOPs, we form guidelines, and we do this on a daily basis. So we make our experience for the patient very, very smooth because every step is taken care of. Vis-a-vis a clinic which does once in a while, which will not have the protocols done. If I'm doing a surgery once in a month, of course, I wouldn't be as experienced as somebody who's doing this kind of surgery every day. Hence, go to a clinic. We have a separate hair transplant department. Entire department in our clinic is dedicated to hair transplant. The operation theatre is only dedicated to hair transplant and hair loss, and hence that makes it even more perfect. There is not only just science behind hair transplant, mathematical calculations of how many hair are required, where to put them, the artistic ability, where to put the hairline, depending upon the age, profession, requirement of the patient. Now, if the patient is an actor, he may require a straighter hairline. If the patient is a businessman, he may not require such a straight or a dense hairline. If a patient has a large area which has to be covered, then you cannot give very heavy density and cover small area, but you have to cover with a moderately large area. So a lot of these age-related factors, profession, psychological, social factors, patient factors, surgeon factors, donor factors come. I have seen often that surgeons do hair transplant. They do maybe 8,000, 10,000 grafts in the first sitting, and then there is no hair left. They put all the hair here, and the patient keeps losing hair on the crown. After 5 years, the patient looks as if he's got a dense tuft of hair here and zero here. It looks very funny. He rather have a moderate density all over. Hence, to predict his future hair loss, to understand how much hair he'll lose in the future, to understand how many grafts he has available for a lifetime, and hence make a lifetime plan for him. This is where the experience and the qualification and the understanding of the surgeon comes, and his scientific, mathematical and artistic ability are all merged together. So artistic ability is as important as the other abilities. If you don't put the hair in right direction, you must have often seen around you that the hair stick up, they go in different directions. Hence the depth, direction, angle has to be perfect for it to look natural. Also, it's important references and reputation amongst other surgeons and amongst patients. If somebody talks about a person, he says he's well reputed, he has enough experience, but he charges a lot, you rather put your head in somebody who may charge you a little more initially but will guarantee you a very good natural result for a lifetime, rather than somebody who will not give you a good result and will charge you very less. Once donor hair is removed and it's put, you have lost it for life. There is no second chances here. Or if it looks stupid or unnatural, it's very difficult to reverse. In my clinic, 22% of the hair transplants we do are corrective hair transplants, where the hairline is not correct, or the distribution direction or the artistic ability is not correct, and then we have to correct it. So don't come for a correction to an expert, you rather come at the first time.